for those of you that don't know me, I'm the Customer Services Director at Lynton, and as part of my role, I'm in charge of the training team, basically. So when I started at Lynton in 2002, I was basically the only clinical person at that point. So those of you that bought your systems a long time ago may have been trained by me, and in fact that's how Jill and I met back in 2004, was it, Jill? I think.
Yeah, I think so. That far back. Yes.
So I mean that was you must have been one of the first adopters really of this sort of technology, because I know that you had prior to that. Well, in fact, you did have experience at another clinic using IPL, didn't you, with Sheila Godfrey?
Yeah, for a couple of years before that. So yeah, over 20 years now. Yeah.
And what first led you to get involved in doing IPL treatments then?
Well, that was because Sheila decided to drop beauty treatments. We did a lot of electrolysis, and we were getting frustrated that some clients weren't getting the results we wanted. So she went down the IPL route originally. So that's how it started, and we became a hair removal and skin clinic. So
and so you started off really as an electrologist, I guess, mainly. That was your main focus.
Electrolysis all day, every day, and then we got the IPL Epilite, and then the Vasculite, and so we started with those. So we still did electrolysis, but a lot of clients then, when they could start to see results from others, moved over and started to have courses of treatment. Yeah.
Right. So the reason I've invited Jill along today, I guess, is because although I have a lot of experience delivering laser and IPL training, product training, core knowledge training, I also work on an anti-aging and aesthetic medicine MSc with the University of Manchester. We do a whole host of other courses with the University of Manchester as well. You're the expert in the educational bits and pieces. So I've got some notes here about your background. So obviously you've been a lecturer for, I think, as long as I've known you. You've always been an assessor, haven't you? And you've worked as an internal, an IQA and an external verifier for who? For CIBTAC and VTCT? Or
I'm not an external verifier, an internal.
Internal.
Yeah.
Right.
So mainly for VTCT. Yeah.
Yeah. And you've worked with Habia in the past, creating the national occupational standards for lasers and IPL.
Yeah.
And then, of course, more recently, you were involved in the LIP-LED group. So LIP, Laser Intense Pulse Light LED group. Is that what it stands for, LIP-LED? As part of the JCCP. So for those of you that don't know the JCCP, they are the people at the moment that are looking to get together the voluntary register for anyone offering aesthetic treatments, I guess. So not just lasers and light, but fillers and Botox and peels and things like that. And perhaps we can talk a little bit more about them later on. So I guess to start off with, the main question that I get from people, and you probably hear the same, Jill, is what do I need? What course do I need to do so that I can go off and do lasers and IPL treatment? And I guess the short answer to that is you don't even really have to do any. There's no law, there's no legislation that says you must have, as a minimum, let's say a beauty qualification or a nursing or a medical qualification. There's nothing like that, is there? And the situation I think that we find ourselves in is that the industry really is regulated by the insurance companies. And so it's the insurance companies that say, yes, we will insure you to do these treatments or not. So some of the big insurance companies, people like Hamilton Fraser, they want you to have a beauty qualification, don't they? Or a medical qualification, a beauty or a medical qualification.
Yeah.
And on top of that, they also want to see that you've had product training from your manufacturer. So if you have a Lynton X-Lite, for example, they want to see that you've had some training on that particular system. And they also very often want you to have sat a core of knowledge. So when I speak to people about this, I kind of say that there's really three aspects to laser and IPL training. There's your safety, laser safety training. So this is, you know, the effects of laser on the eye, on the skin, how to deal with adverse reactions, how to do risk assessments. So that's your core of knowledge, but that's not going to give you any indication about how lasers work, how they get rid of tattoos, how they get rid of hair, for example. For that, you need your clinical training. So that's going to tell you, you know, talk about the theory of selective photothermolysis, if you like, so, who you can treat, who you can't treat, how to do a good consultation, how to get good informed consent from people. That's your clinical training. And so companies like Lynton, for example, can do that for you. But then you also need to have product-specific training. So this is on your particular system, what knobs and dials do I have to turn? What settings do I need to get those results? So we can do, at Lynton, we can, if you buy a system from Lynton, for example, you will get your clinical training and you'll get your product training with the system. And you may or may not choose to come and do a core of knowledge qualification. So we're doing those at the moment via something like this, using Zoom. We're doing those remotely at the moment during lockdown. So they should be done every 5 years. That's what the British Medical Laser Association suggests, that you redo your core of knowledge every 5 years. But then on top of that, we've got all the qualifications. So I'm going to get you, Jill, to sort of guide us through those, if you like, because I think that's where a lot of confusion lies. But in terms of, I thought it might be worth pointing out what the British Medical Laser Association say, because they have something called Essential Standards, and I think it's worth everyone taking a look at those. You can get them from their website. But they have 3 essential standards, and one of them concerns themselves really with training. And what they say is that all laser and IPL system users must demonstrate evidence of having attended laser or IPL operator training, which is system specific and treatment specific. Evidence of training attendance should be held within the establishment. That's the first thing. That's the main thing. Now, most people get that from whoever they bought their laser from, but of course we know that some people are buying systems online, for example, and just, you know, hopefully reading the manual, but then just going out and doing treatments. Now, at Lynton, we can help with, even if you don't have a Lynton system, we do things, for example, like a hair removal masterclass or a tattoo removal masterclass. So you can come and sit on those treatment-specific courses. We also do, if you want an overview of all the sorts of different treatments, we do an advanced skin laser applications course with the University of Manchester. So that one is a really nice course for giving you an overview of all the different types of treatments that you can do with laser and IPL. So that's tattoo, hair, vascular treatments, pigment, acne, etc., etc. But that's not a qualification. That's, you get a certificate of attendance and you'll learn a lot, but we're not testing your competency in that. That's, you know, we're imparting knowledge in these courses. But that's a really nice, I don't think, I mean, you correct me if I'm wrong, Jill, but I don't think there's that many courses that do an overview of all of the subject areas like that.
No, I think Lynton are the only company that do that.
Yeah. The other thing that the BMLA say, as I mentioned, is the core of knowledge, and it should be repeated periodically, at least every 5 years. But then they're also suggesting that there should be compliance with the qualification requirements published by Health Education England in 2015. So for those of you that don't know, after the Keogh report, which was, oh gosh, a few years ago now, one of the things that he suggested was that there should be there should be a qualification that someone can sit if they want to do these treatments. And in light of that, the industry started looking at trying to get together these requirements for these qualifications. So you probably heard of level 3, level 4, level 5. So I guess that's what we can talk through a little bit now to start off with. Shall I see if I can get this presentation up, Jill?
Okay.
And okay, So the first thing, Jill, then what does level 3, level 4, level 5 actually mean? What does that mean?
Okay, can you go to the next slide, Sam? Oh, great. Okay, so so everybody can see there that this is a list of different levels and the academically accredited programs that they are. So if you do, maybe those of you who have already got a level 3 in beauty, you can see that that is the equivalent of A levels. So whether that's a level 3 diploma or an extended diploma, or even if you have a level 3 certificate, that is classed as an A level.
So Jill, they used to talk about a level 3 NVQ or a level 4 NVQ. Is that the...
So NVQ is the same. It doesn't matter whether it's a national vocational qualification at level 3 or whether it is a diploma or a certificate, etc. Or it would still be classed as a level 3. NVQs are actually going. They are now being changed. And long term they will become what we call exam-based, final exam-based, whereas the moment most MVQs are continual assessment. So as you can see there, for those of you who want to come and do our laser qualification at level 4, that is the first that would be the equivalent of an HNC, or it would be the equivalent of a first year of a foundation degree or a BA university degree. The level 5 that we now offer is the equivalent of an HND, or would be the second year of a foundation degree.
So does that just mean that the content is more academically challenging, or
it should be when you get to when you get to level 5, so from level 3 then you're going up to level 4 or level 5, yes, it should start to get a little bit more academic. With the sorts of treatments that we perform, there still needs to be a lot of practical, and there is still a lot of practical, but you'll find, which we'll talk about, what is involved, is when you get to level 5, the assignments are there are more assignments, and they are slightly more academic, yes.
Okay, right, okay. So most of us, whether we know it or not, have got probably level 1, level 2, possibly level 3 qualifications already. We just don't call them that, right? Okay.
Yeah. So if you left school, you did your GCSEs or O levels in my day, and then you didn't do A levels, but you went to college and you did an MVQ or some sort of diploma, level 3 diploma, then that is the equivalent of A levels. Yeah.
Okay. So next slide, what have we got?
Okay, so there are different types of qualifications, and then we thought we would just explain the differences. So the size of the qualification is an indication of how much time you actually, how much qualification time. It's called the TQT, and this could include physical teaching, home studies, coursework, and your assessments. So there are qualifications out there at level 4 and level 5 and level 3 that the first one is an award. So this is a minimum of 10 to 120 hours of learning, and as we said, that's a mixture of actual physical teaching as well as coursework, your practical assessments, your home studies, covering a range of practical treatments.
So that's a really big difference, Jill. So are we saying that someone could have got an award and have only done 10 hours of study, and someone else could have got an award and they've had to do 120 hours?
It could be. I think it depends on, so basically the awarding bodies would put together these qualifications, and most of them would not have a minimum of 10. you know, so there is a new level 4 SIDTAC award that is available, and that is at about 120 hours. So the difference between an award and a certificate, say, I mean, it could be you're doing an award in something different that's nothing to do with laser, and it could be with that award you may only need 50 hours because there's no practical. So it really depends on the subject that teaching. But if we're talking about laser specifically, with a certificate, you're looking at a minimum of 130 to 260 hours. And then a diploma normally would be over 260 hours. But a lot of colleges will put lots of subjects together to make up a diploma. So they might have laser within that diploma, but they also may have chemical peels, micro needling. So they'll make, you know, you can complete a diploma with lots of different modalities, not just laser.
We've got a comment here from someone saying that they had someone approach them for a job, saying that they were Harley Street trained with a VTCT qualification, but she'd only done a course that lasted a few days and had never even really handled a laser before. So, I mean, I guess.
So that is really worrying and disconcerting, because even VTCT and Lynton, we run the level 4 VTCT. And again, it's a certificate. So it should be anything from a minimum of 130 hours. I can't remember exactly how many hours is. I'll try and have a look. But that tells me that there is not enough time for the individual student to be competent, you know, from completing all the range of treatments that they have to complete. And that is quite worrying. The way VTCT work is that we have you have an internal quality assurer, which I'm Lynton's, and I would come on board and I would check in each course that the assessors are teaching in the same way, that all the students seem competent. I will be looking at their portfolios, I will be looking at the hours they've been completing, and also their practical. If you are only teaching for 3 days, they cannot possibly complete all the coursework. You know, we're looking at about 3 months from, you know, filling in the assignments. So it is quite worrying. A lot of these awarding bodies, if you are not happy with a college that you have contacted, you can do something called whistleblowing, and you can contact VTCT and say, you know, I'm not happy. And I have done this a few times when, you know, we have had students come onto the Core of Knowledge that have said they've been on a course for 2 days and they're just not practically competent. So it's up to the internal assurer, but also the external assurer, to make sure that that college is performing competently. And it sounds, you know, if this lady has come for a job and she's only completed it in 3 days, there's no way that she can cover all those practical assessments, cover all the theory as well in that time. It's impossible.
It's very difficult, isn't it, for someone that wants to come along onto a training course to you know, how do you know if the course is going to be any good before you've done it? So I mean, I guess two things that I would be asking about is one, the experience of the people who are actually teaching, who are lecturing on that course, and people doing the assessments. You know, I know that there are colleges out there where the lecturers have literally had a 1 or 2 day training course, and that's their experience with lasers and IPL. You know, they haven't been using it in their own clinics or salons, or even within the colleges for a long amount of time. And also, I think the other thing is, what systems are you going to get the opportunity to use? I mean, we're in a very lucky position at Lynton that we have a whole host of different systems. So if you want to do a hair removal qualification, you can do it with us, and you can use an IPL, you can use an Alexandrite laser, you can use an ND-YAG laser, you can use a diode. You know, we've got a whole load of different options available, and the same if you want to do skin rejuvenation, for example. So I guess that's definitely something that I would be asking people who are offering these qualifications. You know, what systems are you going to get a chance to actually get your hands on and use?
I think you're right, Sam, and I think also the experience of the you know, of the tutors, the assessors. The one advantage we have at Lynton is that the assessors, they are qualified assessors, they all have the qualification, but they have the experience, and that's the difference. You could have been a lecturer for many, many years, but you may have only just been trained in, you know, in the laser or IPL that you offer. And the fact that, and Sam said as well, you have the opportunity with Lynton to actually use different systems. You know, unfortunately, a lot of colleges can't afford a lot of systems, so they may have an IPL. However, you want to go to a college or to a training provider that can offer you IPL and laser, because eventually qualifications will be changing and you need to be able to perform practically in IPL and laser. So that's one advantage Lynton have above everybody else in the UK, really. Yeah.
We've got another question here from Kim saying, if you have a level 4 in laser and IPL and laser, how long would it take to complete the level 5, and what would be the benefit of moving up? So I think we're going to talk about the different courses now.
We have a slide on that, so yeah.
Okay, all right.
Hold on, Kim, we'll get through that. Do you want to go to the next slide, sir?
Yeah.
Okay, so to start with then, for those of you who possibly don't come from a beauty or a medical background, the level 4, the prerequisites for that, there is a new qualification that has come out called the Level 3 Certificate in Principles of Cosmetic Practice. It's been specifically written for those users who don't have a beauty or healthcare background. It's at the moment, the way that we offer it, so Lynton have there's another training provider called Marta who run this course, and Lynton are working closely with them. So at the moment is online learning. There's quite a few modules covering anatomy and physiology, skin analysis, beauty science, etc. There are 2 assignments that need to be completed to do with health and safety, client care and communication, and then you would attend 2 practical days where we would complete skin analysis treatments. There's no laser on this course, but there is some laser theory in there, so it kind of prepares you then to go on for the level 4. This
for people who have no beauty background, in terms of, you know, how to do a cleanse, that kind of thing, you know, how to prepare the skin prior to laser and IPL treatment, is that covered in this course?
Yeah, to be honest, the only thing that is covered in this, you get all the you know, anatomy and physiology theory, the beauty science, etc. But the practical days, yes. So when we say a skin analysis treatment, we are showing you how to cleanse the skin. You know, we are going through different skin types. Does the client have oily? Do they have combination, you know, dry skin? And then we will start to look at, you know, does your client have some broken capillaries? Do they have some sort of pigmentation? The types of things that you could then learn more about on the level 4. So it's giving you that starting point. There is no practical exam at all. It is just a final theory exam. we say it can take 3 to 6 months. It really depends how much spare time you have and how motivated you are at online learning. I actually work with Marta, and I'm the tutor, one of the tutors for this. So we would try and motivate you a bit more. We would keep in touch with you. You know, we regularly keep you updated. So that would be what we would recommend for you to take the level 4.
Someone's just asked, how much is this course?
It's £12.50 plus VAT.
Right.
And that includes, you know, your exam registration fee. That includes the practical days. You know, includes your certificate, etc. Yeah.
Right. Fantastic.
Okay. So at the moment, Lynton we run the level 4 hair and skin certificate with VTCT. This is a 7-day classroom-based course. Now, a lot of you may say, how can you cover the 120 hours, or you know, up to the amount that's required for a certificate in 7 days? The reason we ran it over 7 days, we actually looked we looked at competition, we looked at other training providers to see what they were offering. When we looked at what we needed to go through with the learners, this was the minimum amount of days that we could get it in. There also is coursework, so there are 2 assignments to complete, which you will do in your own time. There's written tests, so we have put those together just to evaluate your knowledge. And then with the VTCT at the moment, it is the equivalent of an MVQ. So it is continual assessments by Lynton trained assessors, and that includes a practical range of treatments. So for hair removal, I think there's 10 different areas.
And so for this, you don't need to have any prior experience with lasers or IPL, do you? You can be completely new and come on this. Or you can...
Yes, no, you can be, you know, if you do have prior experience, then obviously you'll find the practical easier, but you may be using different systems. But also the, sorry, just train of thought, there's someone had sent a question. Sorry, what was the question?
So I guess I was just wondering about people with, on this course we have people with lots of experience, don't we? And people without.
So what we tend to do is we have 6, a maximum of 6 per course, because if we have any more than that, we cannot fit all the practical in. What we tend to do is, if we can, is have 3 who are not experienced and 3 who are experienced. And what we do is we split the groups. And then it means that the 2 tutors, the 2 assessors, can spend that little bit more time with those that don't have the experience, because obviously it may take you a bit longer to pass your assessments.
I should just point out that whilst we're on lockdown, we had a course due to take place later on this month, and what we decided to do is that we will still carry out the theory part of the qualification. We'll do it via, you know, remote learning using Zoom. You'll be able to interact. It won't be like a webinar like this. You'll be able to interact with the lecturer and all of the other people on the course. So if anyone is interested in doing that whilst, you know, whilst we're on lockdown, that is an option to do the theory. And then once restrictions on travel, etc., are lifted, then you can come up to our training academy in Cheshire and complete the practical part of that course.
And you could always, you know, we could go through some of the assignments for you to complete while you're in lockdown, because it's a great opportunity to kind of get them out of the way.
Yeah, absolutely.
Yeah.
Okay.
So that's the current level 4 that we offer.
And that covers hair, and it also covers skin rejuvenation, which touches on treatment of some vascular and pigmented sort of lesions as well, doesn't it? Yeah.
So also it's not 7 days in a row. That would just be far too much. So we split it. We have 4 days of hair removal, and which covers theory and practical. And then there is normally a gap of about 3 or 4 weeks. And then you come back and you complete the next 3 days, which cover the skin.
Okay, I've got some other questions here. I've got one on how much does this course cost? So this one is 1,450 plus VAT for non-Lynton customers, but it's reduced to, or is it 1,600?
650.
1,650 and 1,400
as a Lynton
plus VAT as a Lynton customer. Yeah. Alison, you've asked, do we have these training courses in London? We don't, because our training academy is up in Cheshire, and that's where all of our systems are. But we do work closely with Barnet College, actually, and we run a training course in conjunction with them, a level 4 with them. So if you want any information on that course, if you just drop, for anyone, if anyone wants any information on anything, if you just send an email to clinical@lynton.co.uk, then I'll be able to respond to that and give you some more information. And Derna, you've asked when this level 4 is happening. We've got it scheduled for the 20th to the 22nd, I think, of April, Monday, Tuesday, Wednesday, later on this month. That's when we're going to cover the theory bits. So it'll only be a few hours a day. It won't be, sort of 9 to 5 every single day, but that's when we're planning on doing those theory bits. And as I say, you can get started then on your assignments as well. Yeah, and Kim said, I've examined at Lynton and they have outstanding students in theory and practical. Thank you very much. Thank you.
Oh, hi Kim. Yes, Kim, did you you came along and examined SIBTAC, was it?
Yeah.
No, gone.
Right. Okay, let's move on then to level 5. So the level 5 is in tattoo removal, isn't it? So I know that we have some people that want to do want to progress, they want to do the higher levels, but they're not interested in tattoo removal, for example. But our level 5 course is in tattoo removal, isn't it?
Yes, it is, and it's also a certificate. So again, we have, it's a 6-day classroom-based course, again, but that's split. So there's 3 days to start with, where we cover the theory and start to do some practical. Then there is a longer gap than in between the level 4 dates, because there are 3 quite academically challenging assignments, is probably the best way to describe them, to complete. The tutors will give you some written tests just to evaluate your knowledge and to get you prepared, because with this new level 5 there is a completion of theory and a practical exam with a VT examiner. You still need to complete a range of treatments, and the tutors will be assessing you just to ensure that you are ready for your practical exam. They will be a range of tattoos of different areas of the body with different colours, and with your practical exam you have to treat 2 different colours. So all models are supplied, so we have a good database of models for you to practice.
So I guess the main question that we get on this is, I think we're going to go on to talk about it, but it's prerequisites, isn't it? What do I need to get onto this course? So shall I skip to the next slide?
Yes, skip to the next one.
Okay. Right.
Okay, so your prerequisite for your level 4, awarding bodies and many insurance companies require one of the following. So either a level 3 beauty therapy course from an accredited awarding body, so that could be SIBTAC, VTCT, ITEC, City and Guild. Some type of medical background, so whether that's a doctor, whether that's a nurse, and some healthcare professionals who have got some medical knowledge, maybe some A&P, you know, that there may be a way that you can come on as well. The CIBTAC, and also the CIBTAC level 3 that we discussed, which is the new one that has been specifically written for anybody who doesn't want to go and do beauty treatments, and maybe that you just want to get into laser. Also, this particular qualification is accepted by insurance companies as a prereq if you wanted to go and take a level 4 in peels or a level 4 in radio frequency, because there's lots of new qualifications coming out. So in some ways, this CIBTAC level 3, if you don't want to go down the beauty route, it is a great one to get you started in the aesthetic industry if you are brand new.
And in the relevant stuff, so you don't have to do nails and that kind of thing.
No,
we've got a couple of, Natalie, I think you raised your hand, but if you go down to the bottom, you should see Q&A, and you can just type a question in for us there. I've got a question here from Liz. Hi Liz, can I do the level 3 and then move on to, so Liz I've known for many years and is a very experienced laser operator, but I think I'm right saying doesn't have a beauty background. So she's saying, could I do the level 3 and then move on to the level 5, or will she have to do the level 4 in between? Because she doesn't do hair removal or skin, just does tattoo removal.
Yeah, good question. Good question, Elizabeth. The problem at the moment is that the prereq for level 5 is the level 4, and it's the level 4 joint qualification, which is the hair growth reduction and skin rejuvenation. We have started to have discussions with VTCT about possibly changing that it may be that you just had to do a level 4 in skin rejuvenation treatments, but at the moment that they're not budging. So unfortunately the answer to that is you would have to do the level 4 before you could do the level 5.
Question here from Natalie saying, is the tattoo removal for semi-permanent makeup as well, such as brows? And well, we certainly do cover that in the level 5. So we cover just, you know, standard tattoo removal treatments, but also we do, because it's so common these days, you know, so we do cover treatment of, you know, other types of tattoos, so even traumatic tattoos, amateur tattoos, and medical tattoos, and certainly semi-permanent makeup's included in that as well.
And Helen, have you seen Helen's?
Yes, we're just about to say that too.
Sorry,
yeah. So yeah, Helen, you've got the level 4 and you're wondering if you'd benefit by having the level 5. I mean, it's a really good question, and the answer, so if I just rephrase that question, do I have to have any of these qualifications? And the short answer for most of us is no. Now, in some London boroughs, some of the local councils are insisting on you having a level 4, and that's becoming more and more common. But for most of us, you don't have to have these. So why you would choose to do them, I guess, one for, you know, hopefully you'll learn something by doing them, so for expanding your knowledge. But also, I guess it helps to perhaps set you aside from your competitors. But I guess you need to decide as a clinic as to whether that's worth your while doing. Because currently there's no requirement. Am I right, Jill? And is there any plans to make this a requirement, or?
So I think, Helen, you and I have had this conversation before, I think, as well, that at this moment in time, as Sam, you've said before, we tend to be governed by insurance companies, and a lot of some insurance companies now want you to have a minimum of level 3, but they also want you to have level 4. Level 5 hasn't been out that long. It's only been out about 18 months. And I think long term, it may be that you are going to need to have that level 5. But at this moment in time, they seem happy just with users having level 4. I think level 4 is the more important at the moment, but I think long term it will come. And especially if you want to join, we're going to talk a bit later about the JCCP, the Joint Council of Cosmetic Practitioners, and if you want to join that, the voluntary register, you would have to be working towards a level 5 anyway.
Kim's raised an excellent point here, in that if you wanted to go into teaching or examining for any awarding body, then of course you'd need those qualifications as well. So all of our assessors and trainers, and in fact lots of our sales team as well have all sat these qualifications.
And also from that you get 18, that our tutors had 18 months to complete the VTCT one, which we've done, in plenty of time. And that's the same with when we ran the CIBTAC qualifications. You have to have that or the equivalent.
Yeah, another really good question here from Miglena, hope I'm saying that right, is I've got Lynton manufacturer training and many years experience with the Soprano system as well. And is there any RPL? So that's recognised prior learning, is that right, for level 4?
Yes, I mean we can use some of that as RPL. However, it's more the prereq that we have to look at. So do you have a level 3 in anything?
So I guess what we're saying is that having lots of experience is not a sufficient prerequisite for the level 4, unfortunately, is it?
No, unfortunately it's not. No, it wouldn't be the only thing. We would still, yes, I have CIBTAC. Great. Is that CIBTAC level 3, Milena?
While she's answering, oh yes, it is.
Yes,
well, that would be fine then, wouldn't it?
If you've got a CIBTAC level 3, yeah, that's great. That's that means you could come on to the level 4. That's no problem at all.
And in terms of the RPL, then does that mean that they maybe would have to do less case studies or something? How would we recognise that RPL, if you see what I mean?
To be honest, the way that we are running it, you still need to do that full range of treatments, because it really depends how long you've been performing treatments. So we tend to get you to cover the range anyway. So
Kerry's raised another good point here. Just because there's no formal requirement, I think it's essential that people get qualified. In countries like France, you have to be medically qualified. By getting these qualifications, I think you're future-proofing yourself should the law change. I mean, that's a good point. When I first started at Lynton, we had a massive export market to Japan. And then in about 2002, 2003, they changed the law so that therapists couldn't do treatments in Japan anymore. And so it completely changed. I mean, I don't think there's any chance of that happening in the UK. I should point that out. I think it's very, very unlikely. But potentially they could start saying that you need, as they have in some of the London boroughs, that you need to have a qualification. So
I think more insurance companies will eventually require. I know there are some insurance companies like Town and Country that you can still get insurance just with manufacturer's training and core of knowledge, which is great, for some people. But I think
if you're getting good training from your manufacturer. If you're getting a half a day, then then that's not so good, is it?
And also the support that Lynton give, that we always give that clinical support after your initial training.
Natalie's raised a question. I've done my level 3 in beauty, which I completed in 2011, 2012. Would I need to do A&P again? Well, she wouldn't, would she? I don't think. No?
Natalie, is it an accredited beauty qualification through VTCT, CIBTAC or ITEC? Because if it is, then no, you wouldn't. As long as you've got your certificate to prove that you have that qualification, then no, you wouldn't. We do depend, because you did it in 2000. Great. So Natalie said it's VTCT, so that's good. Natalie, you would do a little bit of refresher A&P. We will give you some homework to do because you haven't completed your beauty qualification within the last 3 years. So that's just something that VTCT require, because we're using that as RPL, as recognised prior learning. However, because it's over 3 years, we just need to give you a little bit of homework, so that would need to be completed.
Okay, it's worth, I guess, highlighting here. I think you said that the core of knowledge is certainly what's the one where there's the exam? Is that there's no exam in the level 4 at the moment, is there?
So no, at this moment in time, level 4, the level 4 that we offer through VTCT is still an MVQ, because they are in the process of updating theirs. And when the new qualification comes out, it will be final exam based, so it will be the same as the level 5, and core of knowledge will be required for level 4. At this moment in time, it's not a mandatory requirement, although we do recommend that most students, if they haven't done the core of knowledge before they complete our level 4, they do it at some point.
And Natalie, you've raised exactly that question. You weren't able to attend the core of knowledge earlier last week. We've got lots coming up over the next few weeks, so if you can attend one of those instead, you'll still be able to do your level 4 theory at the end of April. That won't be a problem.
Yeah, no, that's absolutely fine. Yeah.
We've got another comment from Kerry here saying, I had Lynton training and ongoing fantastic support. Thank you, Kerry. I've been operating 16 years. I even had a BTEC hair, but Lynton SIBTAC I did last year. Oh, VTCT probably, was it? Oh no, SIBTAC, yeah. And the recent VTCT my employee did is hands down the most informative, educational and involved course I've ever seen. Kerry, will pay you later for this. It absolutely gives you the edge over people who haven't done the course. Thank you. I appreciate that. That's nice to hear. And I do think I would say that if you are looking, perhaps you can't travel up to Cheshire or whatever to do the course. Just do make sure that the people who are running the courses have got experience in using these systems, and that you're going to be able to use a wide range of different types of equipment as well when you're doing it.
And check that it is an accredited qualification with Ofqual, that it's not an endorsed qualification. There are some laser courses out there that they say it's accredited, but it doesn't tend to be on the Ofqual register, so you need to double check. But I think if you go with SIBTAC, VTCT, City and Guild, ITEC, BTEC, one of the main awarding bodies, then you are safe. But just make sure as well that the course is longer than 2 or 3 days. It needs to be a minimum, I think, of 6-7 days.
And then you're getting plenty of hands-on time, I think.
Yeah.
Got another question here.
Yeah, so Natalie's put, is the course still running in Cheshire for the level 4 in April at the moment? This is the one, Natalie, that Sam is going to be running online, the theory, and the practical will be postponed until we are able to run that.
Yeah, let's see. What have we got? Oh yeah, it might be worth just mentioning JCCP then before we finish. So Jill, you were on the panel, weren't you, for JCCP? What's their aim? What are they trying to do?
So the aim of JCCP, so the government have asked, so the JCCP stands for Joint Council of Cosmetic Practitioners, and it is basically been established as a non-profit organisation where they are trying to get a voluntary practitioner register, but also a training provider register that's going to be accessible to the general public, so that the patients can go onto the website and see who is a member. And it's basically been put together to provide guidance on patient safety. So this is looking at the competency of those particular individual practitioners. At the moment, because it's non-voluntary, they haven't had as much of a good uptake as they were hoping to. Laser and IPL treatments for hair removal, tattoo removal, skin treatments is part some of the modalities, as well as hair restoration. Botox and fillers is on there, micro needling, peels, different types of superficial peels going up to deeper chemical peels. So if you wanted to become a member of the JCCP, they want you to have the right qualifications. If you wanted to join, they do give you 12-18 months to get a level 4. But the requirement, you know, the minimum level is level 3 to be able to join. So that's why and that's one of the reasons the CIBTAC qualification, the Principles in Cosmetic Practice, was put together. It was something that the JCCP asked Habia to arrange. So the awarding bodies put their heads together, and they came up with with this qualification.
Brilliant. Okay, I think we've got a few more questions, and if anyone wants to ask some, feel free to use that Q&A button there. I have a core of knowledge for acute area. Is that going to be recognised? Yeah, absolutely. That's fine. You know, as long as it was, you know, more than a couple of hours long. Really, there's a lot, and it covers basically the core of knowledge syllabus is outlined by the Medical Devices Agency, and as long as core of knowledge that you've sat covers all of those points, and that should be absolutely fine. Derna, you've said, is this mainly for England? I don't know where in the country you are. If you're in the UK, I know that there are. So, for example, if you're in Wales and Northern Ireland, then the healthcare inspector at Wales and the Northern Irish equivalent request that they want to see training certificates, but I don't think they're specifically saying level 4 or 5, for example, at the moment. And these qualifications are recognised internationally. Is that correct, Jill? I mean, CIBTAC certainly are international, aren't they?
And VTCT are, and ITEC, yeah, they're all international.
So they're all internationals.
Yeah.
Kim says, can you just recap regarding the overall course for the university, the time and the cost? Thank you. Excellent session, both very clear and professional. Thank you very much. Oh, Derna, you're in Scotland. Okay, so in Scotland, again, if you are a medical professional, then you have to register with your authority. And certainly, again, there's no requirement to do these qualifications, but they at the moment, but they certainly would be recognised very much so in Scotland.
You'd probably have to check with your local council. I think that's what most people do in England, isn't it? And there are certain areas where you have to, where you have to have a level 4.
Kim, you've asked about the university course. So we run 2 separate courses with the university. One is the core of knowledge. So the core of knowledge is a 1-day course from 10 in the morning to about 4, and that's delivered by both myself and either Dr. David Binks or Dr. Mark Dickinson, who are lecturers in the physics department at the University of Manchester. So that covers all of the, you know, underlying science and the laser safety and the light tissue interactions. And we also do the 3-day course. Now, I call it the 3-day course. Actually, there's an optional 4th day on there as well. And in that, the first day is pretty much the core of knowledge. And then the rest of the time we spend on different applications that you can do with a whole host of lasers. So for anyone who's got an interest in lasers, it's a really good overview. So we talk about hair removal, skin rejuvenation, acne, new technologies, so things like radio frequency, microwaves, body shaping. We talk about contraindications. You'll get some hands-on time with the systems as well. And there's an optional practical day at the end. That it's optional because we limit it to no more than 6 people. so that everyone can get plenty of hands-on time with that one. And that course is 700 plus VAT for that. Kerry says, when will the level 6 be coming out? I heard this will cover fractional lasers.
They haven't written level 5, Kerry, in quite a lot of the other modalities, so I think the level 6 might be a while.
Right. And Liz has said, would I need to update the core of knowledge if it was more than 5 years old prior to doing the level 3?
No, you don't, Elizabeth, you don't need to have a core of knowledge for the level 3. Because
okay, but if she wanted to do the level 5, which you do, I guess, then you would have to redo it, wouldn't you?
Yes, but you've got time because you're going to have to do the level 4 first. Yeah, so you've got plenty of time for that, but you don't have to do it for the level 3, no.
But lots of them in the upcoming weeks at a reduced price of just £99 plus VAT if you wanted to do a core of knowledge at the moment. We've got those. And again, if anyone's got any other questions or wants any more details, if you email clinical@lynton.co.uk, then we'll be happy to get back to you on that. So, okay, I think that's nearly our hour up, Jill. So thank you very much for all your expertise and knowledge. And yeah, and thanks for listening, everyone.
Thank you.
Stop that.